In this video, we'll be exploring an important medication in psychiatric and general nursing practice, which is mirtazapine. This medication is often prescribed for mental health conditions, and it's crucial for us as nurses to understand its uses, how it works, and the key nursing considerations. Let's delve into its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Starting with indications. Mirtazapine is primarily prescribed for major depressive disorder, anxiety disorders, insomnia, and appetite stimulation. Major depressive disorder. It's commonly used to treat depression, especially in patients with sleep disturbances or loss of appetite. Anxiety disorders, including generalized anxiety disorder and social anxiety disorder. Insomnia, used off-label due to its sedative properties. Appetite stimulation, off-label for patients experiencing anorexia or cachexia, often related to cancer or chronic illnesses. Alright, moving along, let's now learn about the action of mirtazapine and how it works. Mirtazapine is classified as a tetracyclic antidepressant, and it works by increasing the levels of norepinephrine and serotonin by antagonizing presynaptic alpha-2 adrenergic receptors and serotonin receptors. This leads to improved mood and reduced anxiety. What also makes this drug unique is its antihistamine effects contribute to sedation and appetite stimulation. Adverse reactions. Like all medications, mirtazapine has potential side effects. Common ones include sedation, increased appetite and weight gain, dry mouth, dizziness and orthostatic hypotension, and rare effects. Let's go over each one in a little more detail. Sedation, due to its antihistamine effects, especially at lower doses. Increased appetite and weight gain, frequently seen particularly in patients with low initial body weight. Dry mouth, a common anticholinergic side effect. Dizziness and orthostatic hypotension. Patients should rise slowly from sitting or lying positions. Rare effects. A granulocytosis, a severe drop in white blood cell count, and serotonin syndrome when combined with other serotonergic agents. Contraindications. Mirtazapine is not for everyone. This medication is contraindicated for patients who are hypersensitive to mirtazapine, those with concurrent use of MAOIs, and those with severe liver or kidney impairment. Hypersensitivity to mirtazapine. Assess for any history of allergic reactions to the drug. Concurrent use of MAOIs. Patients should wait at least 14 days after stopping monoamine oxidase inhibitors before starting mirtazapine due to the risk of serotonin syndrome. Severe liver or kidney impairment. Use with caution as the drug is metabolized by the liver and excreted by the kidneys. Nursing considerations. Remember that as nurses, we play a critical role in ensuring the safe administration of medications. Here are some nursing considerations. When administering mirtazapine, nurses should monitor for a granulocytosis. Watch for signs of infection such as fever, sore throat, or flu-like symptoms, and notify the provider if these occur. Assess for suicidal ideation, particularly during the first few weeks of therapy or when the dose is adjusted. Monitor weight. Patients prone to weight gain should have regular weight checks and dietary counseling. Assess for sedation. Administer at bedtime if sedation is significant. Educate about alcohol avoidance. Alcohol can increase sedation and risk of CNS depression. Check for drug interactions. Avoid combining with other CNS depressants or serotonergic agents without provider approval. Patient education. Finally, let's discuss what we need to teach our patients. Teaching patients about mirtazapine is critical for ensuring adherence and preventing complications. Purpose of the medication. Explain how mirtazapine helps improve mood, reduce anxiety, and enhance sleep. Importance of regular dosing. Encourage patients to take the medication consistently at the same time every day, preferably at bedtime. Managing side effects. Teach strategies to cope with dry mouth like using sugar-free gum or lozenges, and advise patients to report excessive sedation or dizziness. Recognizing serious symptoms. Educate patients on the signs of serotonin syndrome such as agitation, confusion, and rapid heart rate, and when to seek immediate medical attention. Lifestyle adjustments. Encourage a healthy diet and regular physical activity to mitigate weight gain. Duration of therapy. Stress that the full therapeutic effects may take 4 to 6 weeks, and abrupt discontinuation can lead to withdrawal symptoms. Mirtazapine is a versatile medication used for depression, anxiety, and other off-label conditions. Understanding its indications, mechanism, and side effects is essential for effective nursing care. Alright, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. See you again.